Hello to everyone. In this video, I will be giving you a brief overview regarding the important concept, which is the coronary bypass surgery, how it is done and when it is done. So it is done when there is the disturbance of blood flow in the arteries of the heart. So this surgery is actually performed in the severe cases when there is any type of disturbance in the blood flow in the arteries of the heart. That is the coronary arteries. These coronary arteries are the arteries of the heart. So in that case, we perform this coronary bypass surgery. Okay, and now CHD, coronary heart disease, is a disease associated with the lack or complete cessation of the blood supply to the muscle tissue of the heart. So cardiovascular disease or coronary heart disease is actually the concept when there is decrease in the blood flow to the muscles of the heart, that is myocardium. Okay, so that is the case of coronary heart disease, how the coronary heart disease occurs. Okay, so this is the main concept. Now what are the causes behind this? So we have the atherosclerosis, the one of the most common cause, which is the plaques, or the persons who have high cholesterol levels, and because of that there are depositions of these plaques inside the arteries, and which narrows the arteries, and there is decrease in the blood flow to the heart region. Okay, and stress can be the factor also. And if we talk about the epidemiology, you can see the 31% of death in the world per year is due to the cardiovascular disease. Okay, so it can be any type of coronary heart disease or other diseases, myocardial infarctions, other diseases. So 31% of death are related to the heart diseases. Now the risk factors, you can see. So risk factors, we have the person who smokes, and persons who are on the high fat levels, or you can say the high lipid levels in the blood, that is cholesterol levels, and who have the high blood pressure, high BP, and people who are suffering from diabetes. Okay, so these persons are more susceptible to the pathology of coronary heart disease or the disease related to heart. Okay, so here this is the image regarding the heart disorder. You can see this is your heart, and these are the vessels. You can see this is the vessels, right coronary vessels, left circumflex, and in this you can see this the magnified view of one of the artery. This is a magnified view of this artery. You can see these are the plaques here, deposition of 70 to 80% of collagen in the left anterior descending branch of the coronary artery. Okay, so this is the left anterior descending branch of the coronary artery, in which there is 70 to 80% of occlusion due to the deposition of plaques. Okay, so this is the main concept behind this coronary artery disease, and which there is only single coronary artery. There can be many, that is 1, 2, 3 coronary arteries can be damaged due to this occlusions, or they can be narrowed. So we have to perform 2 or 3 coronary artery bypass surgery. Clear? So you can see in this we do the sternotomy. Okay, we remove the sternum from the midline. Okay, incision is done, scalpel is made and cut. Okay, in this diagram you can see, this is the diagram, scalpel, and then we retract. This is a retractor, so we retract the skin or scalpel fascias. Okay, so we actually do the sternotomy, removal of sternum, and self-retainer erectile flap, pericardium inside, and heart is exposed, and after that we are able to see the heart, the vessel. Clear? Now let's see some more factors here. It can more prominent in male, advanced, that is older age, and genetic also. It can be the case of, and the women who have menopause or post menopause are also more susceptible to this coronary disease. Clear? Now how this coronary artery bypass surgery is done. So as I told you, first incision is done. In this diagram you can see the first step, we do the incision in the center of the midline of the chest, which what I have written, incision of the chest is done firstly and made sometimes in the middle of the ribs. Okay, so in between the ribs we actually do the incision. In this diagram you can see in this. Okay, the cut here is the incision site. This is the incision site first of all, then we expose this the sternum wall, and after that we expose the heart. Okay, then the heart is visible. In this diagram you can see by the retractors and the self-retaining retractors and the retractor of the heart. Okay, so this is the area which is exposed. Now the second step is we prepare the heart prosthesis. Okay, so now we have to do the bypass surgery. We have to deposit other prosthesis, which is just like a shunt, you can say, which will just act as a bypass blood flow for the heart to resume the proper normal blood supply. So in that case we use the great saphenous vein from the leg, radial artery we can cut, and the internal thoracic artery. Okay, so these are the arteries which are used in the bypass surgery and performed by. Now after before performing the surgery, we have to put the heart on the artificial circulation. Okay, so normal heart circulation is stopped, and we use a machine which is called a heart lung machine, and put a cold solution in the heart, and the artificial circulation is going on. Okay, so normal is stopped, but we use artificial circulation till the surgery is being performed. Okay, so now shunt are placed. Now shunt, the meaning of shunt is, you can see in this diagram. So saphenous vein, you can see we cut one of the part of this saphenous vein, and we put just like here bypass surgery. So where there is occlusion or there is plaque, just above that we put the first point here and other point in the aorta. So this is actually your aorta. Okay, so this part is aorta, so we are bypassing it, so we are adding one of the shunt here. So this is actually your prosthesis. Okay, so this is a shunt which we have gained from the saphenous vein, or we can use from the internal mammary artery also, internal thoracic or mammary, which are present on the both the side. Okay, so you can see this one is this artery, and this is your saphenous vein which has been put here, and the bypass has been done above the narrowing. Okay, so if there is any plaque here, so we will put the cut here, or we will be putting or pasting the artery here. Okay, the prosthesis. Clear? So this was the concept behind this. When we can use this CABG, that is coronary artery bypass surgery, and the person has 60 to 80% of plaques, okay, which I told you, and have 2 or 3 coronary arteries occlusion, or atherosclerosis in 2 or 3 arteries, about 60 to 70%. Now we have to perform the surgical operation. Stenosis of specific, like left coronary artery, if there is stenosis in that, and if we have the myocardial infarction, and if we have unsuccessful angioplasty. And this surgical treatment is effective up to 10 years. Okay, 10 to 15 years it is effective, and after that there may be some of the complications. Again, the patient may again suffer the symptoms of this coronary heart disease. Okay, and complication percentage is about 4 to 6% after surgery. So it is very rare that there will be any complication after this coronary artery bypass surgery. Okay, so I think it is clear. So thank you, and this was the images, and this was the surgery and the bypass grafting after the post-operative. This is the image of the post-operative. You can see this image, which is representing the completion of the surgery, how the surgery has been completed by putting the cut section or prosthesis in the heart. Okay, and the normal circulation is begun. Clear? Thank you.